find the sternal end of my clavicle, please?
This is
I really want to go and do that.
It's just right there.
Acromial end? You can do the acromial end of my
It's
clavicle.
up to you.
You just start pointing to him.
Yeah, come on. Acromial end. Acromial end. It's my shoulder. It's okay.
Right around this area.
Yeah.
I'm not doing sternal.
So do you want to like tell us the hints that you'll be giving us like during the quiz?
I haven't come up with all of them exactly.
Oh, okay.
I'll try to do my best while I talk through. Okay, so clavicle end, acromial end of the clavicle, you follow your clavicle out. So it's kind of the top portion of your shoulder here. So then my sternal end, Jessie, are you willing to do the sternal end?
Sternal end, yes. She's like, why not?
So then the sternal end of my clavicle.
Right there.
Yeah. So in here. So, Lucinda?
Yes.
Did I say it right?
Yes.
Scapular spine.
I'm not even in this class. What am I trying to find?
Scapular spine.
It's right in here.
Yep, it's just that bony part there on the back.
So right here, it runs along and you can feel the supraspinatus above it, and infraspinatus below it, and you just find like the root.
Beautiful. You can be the teacher. That's great. Okay. Baumgart. Karina. Sorry.
Remembered your last name. That's funny.
She's like a Acromion process.
I think this one's hard too. I'm gonna get closer.
Which side are you? Your thumb or your fingers?
My fingers.
Okay, so that's kind of my clavicle. Yeah, go back slightly. So here's my clavicle. Here's the divot between them. So here's my acromion process. So you have the clavicle, it's on top, and then there's a little drop off, which I lost. It's about right there. And then my acromion's on the more the back of the shoulder. Back top. Okay, coracoid process. Melinda, right?
Yes.
I do not know why my brain is having issues today. The name center is like down, I guess.
That part of the brain isn't working.
Yeah, I apologize.
Okay.
Yes. So, Kimberly, you had a good way to kind of explain where this was, I thought. How did you explain how to find the coracoid process?
Follow your clavicle,
Okay, so follow the clavicle.
and then there's like a little V,
So kind of this area right here.
and then right in the middle of that V is your coracoid process.
Yeah. So which is follow your clavicle. And then there, it kind of makes a V with like your shoulder joint. So there's kind of a corner here, and then your coracoid is nestled in that one.
Oh, I feel the bee.
Yeah. Yeah, I like that. Okay, Dallas.
Oh yeah.
Medial border of scapula. And then Jacob, you'll have the inferior angle of the scapula.
Okay. It's medial scapula. It's like
Yep. So it's does it run horizontal or up and down? Or? Yep, it's the up and down part that runs parallel to my spine. So in the middle here. Awesome. Okay, so inferior angle. Can you need to like display that or something? Yeah. So the bottom of my scapula. Okay, superior angle. Denise? superior angle of the scapula? Yes. Oh, is there an updated version of that list? No, I'm just, it says angle, and those are the angles I know of the scapula. Yeah. Yep. The superior angle is where the medial border and the edge join. Okay. Humeral head. Veronica.
Yeah. I don't really know how to
Grab that. It's okay. It's like in there. It's like that's very true. So if you can you find like my acromion and clavicle, and then right where they drop off, there's a little divot. Yeah, you're really close to it. About right there. About right there. That's the humeral head. Or like if you find your greater tubercle, like kind of set your finger on top of it. So your finger's resting on your greater tubercle like this. You're kind of touching the humeral head on that side. That makes sense?
Mm-hmm.
So where you drop off the shoulder. You can feel the edge of it, but most of it's in the joint. Trevor? Hey, greater tubercle. Okay, so how would, can you describe in words a little more how to find that to the class?
Isn't it just the part that's hanging out? And when you rotate, you can feel it move.
Yeah, when you rotate, you can feel it move. I have to go through and find my humeral head. So drop off the divot, put one finger on my humeral head, put another finger down below, and the lower finger will feel the greater tubercle rotating. So, is it Tyler? How do I find my intertubercular groove? Come show us that, please. Okay, so it's even warmer. So find my greater tubercle. Yeah, right. And can you feel the bump rotating? And when I go about there, your finger should drop into like a little. Yeah. Okay. So your intertubercular groove. I was talking quiet. Shame on me. So we have our greater tubercle. Find your greater tubercle. And when you rotate your arm not quite 180 degrees, your fingers drop into a divot. That's your intertubercular groove. Okay, medial epicondyle.
She's all excited about this.
Amber.
Is it this one?
Right there, it's that one.
What's that one? It's like that. Okay, so your elbow, and then you have that little gap in between, and there's another bone right there.
Yep. And right in between, I heard someone say funny bone. That's where the nerve. Does anyone remember the name of that nerve? Your ulnar nerve. Yep. Awesome. Good job. So I need a lateral epicondyle from Kimberly, right? Okay, so here's the medial one.
Okay, wait, where's your thumb?
Yep, it's this right here. There's your lateral epicondyle.
Are you okay?
Never had someone videotaping my elbow before.
Sorry.
It's okay.
It's the first time for everything.
Radius, the head of radius, Kimberly.
You should be able to feel it move, right?
You can feel it move. Put your finger there. Can you feel that moving? Yeah. So what I like to do, you can go ahead and sit down. I find my lateral epicondyle, and I go about 2 finger widths over, or a finger width and a half. And then this finger should be about on the edge of my head of the radius. And you should be able to feel it rotate when you go like this. Is that? Raise your hand if you can feel your head of your radius, the head of your radius.
I can't do it.
Awesome.
I did before.
I hope
Yes.
it's the head of my radius.
Should be, unless you have something like broken. Okay, Amber,
Mm-hmm.
styloid process of my radius.
Oh, your arms are against your side. Down here, right?
Look for a bump.
Like this little bump.
Yeah, kind of more on
It's way more prominent on my side.
Yeah, where is it on you? Can you hold it up and show the class? Is that okay? Yeah, so your styloid process is the bump on the wrist side that you can't really see on me.
Oh, thank you.
But there's supposed to, on the thumb side, thank you, on the thumb side of the wrist. So that's the styloid process of the radius. So then on the ulna, the styloid process, where would that be, Amber? Or you're not Amber, you're Karma, sorry.
It's the bigger bump.
There?
Yep, it's this one, this bump. By your pinky, yeah. Some angles you can see it really well. I kind of have two bumps. It's the lower bump, because the higher bump is the carpal. So it's this one right here. Olecranon process. Jen. So touch the kind of tip of it. Yeah, there's your olecranon process.
Your elbow.
Okay, Brittany, where's my iliac crest going to be? Don't stress.
He's got a model.
Yeah. So iliac crest is
Like where
the bony part of your hip.
okay.
Rebecca, where would be my anterior superior iliac spine?
It's like where it points
So
forward.
Find your iliac crest and then move forward and then like
Up there, right here.
It's the part that like pushes on your jeans.
or like here. We can look on this guy so we can actually see.
I think there's one on him.
So it's this, right?
Yes, it's that right there.
So yeah, this is your crest and then you move down. There you go.
Yep.
So you have to remember your hips aren't flat, they kind of curve around.
Curve
So
forward.
you follow the crest as it curves around and then it kind of
Oh, my
drops
pinky
off.
was in the way.
That's the spine. That's how I do it. That's what it feels like on me.
Okay.
So it curves around and then the corner is the spine, the anterior superior iliac spine. So, Adri, could you explain how to find the posterior superior iliac spine?
Well, you say if you find your back nipples,
Okay.
and then and then you pull your thumbs out, right? And then it's right there.
Yeah.
So it's
how
like
I find
that bony part, like by your dimples.
So the bony part by your back dimples.
Okay.
They're just lateral to your back dimples. So what you're actually doing, we can turn Mr. Bones around. Your back dimples is this joint right here between your sacrum and your iliac. So when you put your thumbs in your back dimples, you're essentially putting your thumbs right here. When you go to pull them out, you catch on the posterior superior iliac spine.
Okay.
That's how you find those. So Tyler, how do you find your ischial tuberosity? It's what you sit on. So if you sit on your chair and kind of rock back and forth a little bit, you can feel it. Or you
Oh.
can sit on a hard chair for 3 hours, you're also going to feel it.
Feel it. On a bike.
Sitting bike and you can feel it so bad.
Yeah. Okay. You probably don't want to find my greater trochanter. My favorite
right here.
Okay.
It's like, no.
We'll give you